Hi everyone, Lindsay here with Elite Insurance Partners and MedicareFAQ.com. Welcome. If it's your first time joining us, we're very happy to have you here. Now, there are many different enrollment periods when it comes to Medicare. Today, we're going to talk about the General Enrollment Period. The Medicare General Enrollment Period runs annually between January 1st and March 31st. It is the second opportunity you have to enroll in both Medicare Part A and B. The first time you can enroll in Part A and B is during your initial enrollment period, or your IEP. Your initial enrollment period is triggered by your 65th birthday. It will begin 3 months before your birthday and last 7 months. So, if your birthday is April 5th, your initial enrollment period will run from January 1st to July 31st. Another way your initial enrollment period can be triggered is if you're collecting Social Security disability income. In this case, your initial election period will begin the 25th month you are collecting benefits. Now, when you enroll during the general enrollment period, your coverage will begin July 1st. Many of you may be wondering, well, what happens between January and July with coverage? You're going to end up going without coverage. That's why the best time to enroll is during your initial election period. This is because your coverage will begin the following month after you enroll. Most people are eligible for Part A premium-free and choose to enroll as soon as they're first eligible. Others may choose to delay their Part B because they have credible coverage. An example of credible coverage would be if you're actively working and covered under a group health plan through your employer. If you delayed enrolling due to having credible coverage, you'll be eligible for a special enrollment period. You won't have to wait for the general enrollment period to enroll in Part A and Part B. Unfortunately, most Medicare beneficiaries are unaware that if they delay enrolling into Part A and Part B without credible coverage, they're going to see some penalties. For Part A, the penalty will start accruing 12 months after your initial election period. Now, this penalty will stick with you for 2 times the amount of years you went without coverage. So, for example, if you went a full 24 months without coverage, you're going to have to pay that Part A penalty for 4 years. And that penalty is 10% of the current premium for each full 12 months you went without coverage. With Part A, your penalty will only last 2 times the amount of years you went without coverage. Unfortunately, with the Part B penalty, it will stay with you the rest of your life. Now, there are only 2 ways around these penalties. One of them is if you're low income and you qualify for a Medicare savings program. And the other one is if you're collecting Social Security disability income and you were paying these penalties. When you turn 65, those penalties will then be waived. Now, if you're a low income beneficiary, you may have some other options. If you decline Part B because the premium was just too expensive, there are 3 Medicare saving programs that you may qualify for. These Medicare saving programs will pay your Part B premium and also protect you against any penalties. If you do qualify for a Medicare savings program, you can enroll anytime. You don't have to wait until the general enrollment period to enroll. Your MSP will trigger your Part B enrollment. In addition, to qualify for a Medicare savings program, you must be enrolled in Part A. Now, if you didn't work enough quarters and you don't get Part A premium free, so you declined it due to it being too expensive, you may qualify for a qualified Medicare beneficiary program. And in this case, it will cover your Part A premium. Now, I could go much more into detail about these qualified Medicare beneficiary programs and these Medicare savings programs, but that would make this video over an hour long. So, we'll make sure to include some links below to our MedicareFAQ.com to where it will go over these in more detail. For those looking for prescription drug coverage, when you use the general enrollment period to enroll in Part A and B, you'll actually get a Part D special enrollment period. This special enrollment period for Part D will be between April 1st and June 30th. The effective date will be alongside your Part A and Part B, which is July 1st. I know that was a lot of information. Hopefully, you have a little bit more clarification on the Medicare General Enrollment Period. If you have any more questions at all, please post comments in the sections below. We will answer them as soon as we can. And if you haven't already joined our Facebook community, make sure to do so. We'll post the link below. We post information and new content regularly to keep you informed and up to date on all of your Medicare benefits. Until next time, bye!